Tarun, studies often say men visit doctors only when something is already on fire. What does this say about how we approach chronic lifestyle diseases, and how do we convince men that prevention isn't a conspiracy?
Yeah, that is an interesting question. In general, what we have seen that you don't take care of a small spark unless the room is completely ablaze, right? So, like diabetes, hypertension, these things they start slowly, but when you ignore them, they become really, really troublesome for you in the later years, and the
Right.
cost of management of these diseases is quite high. Not just for the employer, employee, as well as entire healthcare system gets impacted.
Right.
So my take on this is everyone has to, accept the fact that men are not a machine. Even a machine requires maintenance. It requires preventive care also. Same way as humans or as a men, we should have periodic preventive healthcare checkups time to time to understand how your health stands at a particular given time, and then what interventions are required so that you can be ahead in the health-related, your pursuit. Everybody wants to be healthy, but if you take charge at the right time, you're taking right steps, it'll definitely help you in longer run. Your performance at work, your behavior at home, you will have quality of life. All these things are connected, interconnected. So in short, I would say prevention is always better than cure. It's a cliche, but it is so true in the healthcare world. And let's not wait for a fire to happen. I think we should take small little steps when it is just a spark and live a healthier life. That's what my take on this.
No, I think very well put, and I believe every single word that you say, Tarun, because Tarun is also a person who practices before he preaches it. He is himself a health tech enthusiast, as he also calls himself, or as his LinkedIn title. It's Tarun Thakur, health tech enthusiast. And when it comes to health, be it a marathon, be it a cyclothon, Tarun is always the front runner. So an advice coming from Tarun is definitely one to take seriously.
So can I add a little point to what
Yes,
you said?
please, Doc.
So this is about the attitude, the difference between men and women in their
Correct.
taking care of their health. And I think this is an important point, because what you pointed out was absolutely correct, obviously. I mean, take care of the spark, don't allow it to become a fire. But men have two reasons to avoid that. One reason that I find in my dealing with so many patients is that it's not a macho thing.
Exactly.
It's be a man type of thing.
Yes,
Why
yes.
crib about small things? Why do you worry about this test? Come on, man, you're feeling
Yeah,
fine.
men
just go
are
ahead.
made of steel sort of
Yes, so
attitude.
men feel that they're perceived as weak or even feminine, if I may say. very
Mard ko
sexist.
dard nahi
So
hota.
But very macho, kuch nahi kind of thing. So one is this.
Correct.
This is clearly one reason. The other is that they feel that if they're so focused on their profession and their professional curve, that they feel if they find something, it'll be restrictive.
Restrictive.
Yes.
That stigma. That
When
Yes.
couples come to the OPD, and
Yes.
often it's the man who's the patient. So if you talk to the husband, the male member, and he's not even looking at you. It's like he's been bound hand and foot and brought to the doctor. They look that side. I said,
No eye
Mr.
contact.
Agarwal, what's your problem? He'll say, I have no problem. I don't know why she's insisting. I'm absolutely
She's
fine.
insisting.
I said, but his sugars are so high. I told her I'll fix it. But I know I can fix it, doc. I don't need any medical help.
Right.
So it's a very different approach that I find based on gender in this. It's unbelievable how men will just completely deny the existence of any problem for a very long time.
So true. Yeah.
Yes.
Yeah. Actually, picking up on that point, which I murmured in between, ki mard ko dard nahi hota. My next question to Dr. Amit. Dr. Amit, we all know that cardiac health is one of the top killers amongst men. So, if the heart were to send a WhatsApp message to you, complaining about some pain or whatever, what would it be?